Asbestos is a naturally occurring mineral that has been linked to human lung disease. It has been used in a huge number of products due to its high tensile strength, relative resistance to acid and temperature, and its varying textures and degrees of flexibility. It does not evaporate, dissolve, burn, or undergo significant reactions with other chemicals. Because of the widespread use of asbestos, its fibers are ubiquitous in the environment. Building insulation materials manufactured since 1975 should no longer contain asbestos. However, products made or stockpiled before this time remain in many homes. Indoor air may become contaminated with fibers released from building materials, especially if they are damaged or crumbling. One of the three types of asbestos-related diseases is asbestosis, a process of lung tissue scarring caused by asbestos fibers. The symptoms of asbestosis usually include slowly progressing shortness of breath and cough, often 20 to 40 years after exposure. Breathlessness advances throughout the disease, even without further asbestos inhalation. This fact is highlighted in the case of a 67-year-old retired plumber. He was on Ramipril to treat his hypertension and developed a persistent dry cough, which his doctor presumed to be an ACE inhibitor-induced cough. The Ramipril was changed to losartan. The patient had never smoked and did not have a history of asthma or COPD. His cough worsened and he complained of breathlessness on exertion. In view of this history and the fact that he was a non-smoker, he was referred for a chest X-ray and to the local respiratory physician. His doctor was surprised to learn that the patient had asbestosis, diagnosed by a high-resolution CT scan. The patient then began legal proceedings to claim compensation as he had worked in a dockyard 25 years previously, during which time he was exposed to asbestos. There are two major groups of asbestos fibers, the amphibole and chrysotile fibers. The amphiboles are much more likely to cause cancer of the lining of the lung, mesothelioma, and scarring of the lining of the lung, pleural fibrosis. Either group of fibers can cause disease of the lung, such as asbestosis. The risk of developing asbestos-related lung cancer varies between fiber types. Studies of groups of patients exposed to chrysotile fibers show only a moderate increase in risk. On the other hand, exposure to amphibole fibers or to both types of fibers increases the risk of lung cancer twofold. Although the Occupational Safety and Health Administration, OSHA, has a standard for workplace exposure to asbestos, 0.2 fibers, milliliter of air, there is debate over what constitutes a safe level of exposure. While some believe asbestos-related disease is a threshold phenomenon, which requires a certain level of exposure for disease to occur, others believe there is no safe level of asbestos. Depending on their shape and size, asbestos fibers deposit in different areas of the lung. Fibers less than 3 mm easily move into the lung tissue and the lining surrounding the lung. Long fibers, greater than 5 mm, cannot be completely broken down by scavenger cells, macrophages, and become lodged in the lung tissue, causing inflammation. Substances damaging to the lungs are then released by cells that are responding to the foreign asbestos material. The persistence of these long fibers in the lung tissue and the resulting inflammation seem to initiate the process of cancer formation. As inflammation and damage to tissue around the asbestos fibers continues, the resulting scarring can extend from the small airways to the larger airways and the tiny air sacs, alveoli, at the end of the airways. There is no cure for asbestosis. Treatments focus on a patient's ability to breathe. Medications like bronchodilators, aspirin, and antibiotics are often prescribed, and such treatments as oxygen therapy and postural drainage may be recommended. If symptoms are so severe that medications don't work, surgery may be recommended to remove scar tissue. Patients with asbestosis, like others with chronic lung disease, are at a higher risk of serious infections that take advantage of diseased or scarred lung tissue, so prevention and rapid treatment is vital. Flu and pneumococcal vaccinations are a part of routine care for these patients. Patients with progressive disease may be given corticosteroids and cyclophosphamide with limited improvement. Chrysotile is the only form of asbestos that is currently in production today. Despite their association with lung cancer, chrysotile products are still used in 60 countries, according to the industry-sponsored Asbestos Institute. Although the asbestos industry proclaims the safety of chrysotile fibers, which are now embedded in less friable and dusty products, little is known about the long-term effects of these products because of the long delay in the development of disease. In spite of their potential health risks, the durability and cheapness of these products continue to attract commercial applications. Asbestosis remains a significant clinical problem even after marked reductions in on-the-job exposure to asbestos. Again, this is due to the long period of time between exposure and the onset of disease.